Hello, my name is Madion, and I will be discussing 10-year trends in laparoscopic hernia repairs in NSQIP database review. I have nothing to disclose. Overall, the utilization of minimally invasive techniques for ventral and inguinal hernia repairs has continued to rise in recent years. Adoption of these techniques varies both regionally and globally, and recent guidelines recommend that choosing between an open and laparoscopic repair technique be guided by multiple factors, including surgeon experience. However, data does support the utilization of laparoscopic repairs with postoperative pain, return to work, and decreased wound morbidity. The purpose of this study was to provide an update on the national utilization trends of laparoscopic versus open, ventral, and inguinal hernia repairs. This was done through querying the National Surgical Quality Improvement Program database from the years 2006 to 2017, wherein all CPT codes that correlated to laparoscopic inguinal, open inguinal, laparoscopic ventral, and open ventral hernia repairs were queried. The number of cases and total wound complications for each CPT code were collected and compared over each year. Overall, looking at the trends in the utilization of laparoscopic ventral and inguinal hernia repairs combined, there's a increase seen from 20% to 37% over the years 2006 to 2017. When breaking this down with just ventral hernia repairs, there's not as significant of an increase seen in the years 2009 to 2017 when we were able to distinguish between ventral and inguinal hernia repair CPT codes. There's an increase seen from only 31% to 36% with ventral hernia repairs. In looking at inguinal hernia repairs, there is a much more significant increase observed, rising from 23% utilization of laparoscopy in 2009 to 37% in 2017. In looking at overall wound complications, there's overall unchanged. The most significant wound morbidity was seen in the open ventral hernia group, which is consistent with prior data and studies. The limitations of this study were primarily in the limitations of the details we were able to get for each hernia repair. When looking at the inguinal hernia repair specifically, the CPT codes do not even distinguish between the type of laparoscopic approaches, including transabdominal preperitoneal, total extraperitoneal, or any robotic equivalent, as well as the complexity of any ventral hernia repair. But overall, it can be concluded that over the last 10 years, the utilization of laparoscopic hernia repairs has increased by nearly twofold, with a larger proportion of this increase being seen secondary to the utilization of laparoscopy for inguinal hernia repairs compared to ventral hernia repairs. This highlights the continued growth of laparoscopy and hernia repairs over the last decade. I thank you for your time.